This is the Bryn Show, where we discover what's inside the deep, dark hole called your mouth. Are you ready?
All right. Welcome to another episode of the Bryn Show. I am super excited that we have Dr. Caroline Long here. So if you've been watching our social media and all, you know that we've been getting ready for this a couple weeks and featuring her. So we'll jump right into it. Caroline, why don't you tell us, or Dr. Long, sorry.
No, it was fine.
Why don't you tell us just a little bit about who you are and what you do?
Sure. Well, thanks for having me, Dr. Cooper. I'm Caroline Long, and I'm a chiropractor who's certified in pregnancy and pediatric chiropractic with Westview Wellness. And Westview Wellness, I started it with my business partner about 16 years ago.
You're over the hump. It's established. We can all aspire. All of us little baby business owners that have been in business 5 years or less can all aspire to what Dr. Long does. So
Yeah. You think you get to a point where you can just coast, and it's never that way.
Right? I have heard. Well, I've even experienced that already a couple times. Like I'm like, oh, if I can just get X number of employees or whatever,
Right.
You think it's gonna be easier. And the thing is, I don't know if it's this way for you, but for me, I felt like my goal would then move,
Yes.
right?
Yes, for sure.
So then I would go chasing after that one, and it's this continual thing.
Yes.
But it's fun, right?
It is fun. It is fun.
All right. So we'll do a couple icebreakers. One of them is, what's your favorite subject in school when you used to go to school?
So in high school, my favorite subject was psychology. I thought, ooh, if I could psychoanalyze people and find out what they're thinking, that would be really cool. And so I majored in psychology in college, and it wasn't as cool as I thought. And then I liked anthropology in college, so I thought that was really, really neat.
Yeah. So how did you find anthropology? Did you sign up for it randomly? Was there a professor you heard about?
I think I had somebody on my floor who was an anthropology major.
Okay.
And I was like, okay, I know about the store. What is anthropology as a major? And so, and I thought that it was like fossils, and paleontology. And she said that's a small aspect of it. But there was actually a class called the anthropology of food. And I love food. And so that was really fun to find out why we eat certain foods in the order that we do and how it evolved. And then one class was on sugar and how sugar was used as a resource for preserving food.
Yep.
And then sugar meant you were wealthy if you had sugar back in the day, and salt too. And that was really fascinating.
The India trade, right, with all the spices.
Right.
So what? This is a totally random question, but there are certain cultures that will eat salads before their meal versus
Yes.
other cultures that will eat salad after their meal and soups and things. Do you know why that
I
is?
do like to.
Oh, good.
Okay, so there is a wild green that grows called gentian, and there's other ones too. And now we eat like radicchio and arugula, right?
Yeah,
And things like that. The reason that we eat those bitters is because it gets the stomach acid going. So then you're able to digest that big meat or whatever is coming down because your stomach acid is going and you triggered it to be like, I need to eat, I need you to produce enough acid. But of course, people were like, oh, it's so bitter, oh, we're so modern, let's do iceberg lettuce or something that's more palatable, which does not obviously have the same effect,
Right.
and especially when you drown it in ranch or something like that. So now you see that the trend is going back towards those bitter greens that people are craving, and it's actually supposed to be better for your digestive system. So I know in Germany, they eat half their salad, then they eat their meal, half their meal, then they eat the other half of their salad, then they eat the other half of their meal. Yeah, I don't know about the soups, but I did know about the salad. I thought that was really cool.
That is awesome, and we do see kind of that trend towards bitter coming back, I think.
Yes.
Which there's all sorts of food philosophies, but I subscribe to the one where you need like sweet and bitter and savory and all those different things serve a purpose. So.
Yeah, I think so. I mean, it's all supposed to stimulate your palate in different ways, and then that develops your palate, especially for babies. We want them to have a well-developed palate, at least lay the foundation for it.
Yeah. Do you do a lot of like nutritional coaching since you had some of that anthropology in your chiropractic practice?
So in chiropractic school, chiropractors aren't allowed to prescribe medication. We take one pharmacology class, but it's nowhere near in depth what some other health disciplines do. And so we try and focus on nutrition and using food as medicine and vitamins. So chiropractors get a year's worth of nutrition classes, which is more than like medical doctors. But then I went and took like 300 hours extra in nutrition and functional medicine, and it's an evolving field. So like the stuff that I learned is already antiquated. So we do try and incorporate that a lot in our office because people are turning to us saying, you know, my doctor just said take this medication, and is there something I can do in terms of herbs or vitamins or essential oils? So we try and educate ourselves about that.
Yeah. No, and it's interesting, and I think food has started to seep over into oral health as well.
Yes.
And so that has become an emerging interest of mine as I get further and further into practice and kind of see the interplay. And so I think that's awesome because I got like, I think half a credit in dental school. So that's awesome that you have all this vast nutritional knowledge.
Yeah.
So, yeah.
I try.
There we go. So nutritional counseling also at Westview Chiropractic. So that's good. Okay. So tell me a little bit about what inspired you to open your own business, you know?
So my parents are business owners, and I thought that was the American dream to, you know, be successful and open your own practice. And oh boy, it's a lot of work. But I felt like I could build a different kind of chiropractic practice than I've been seen before. There are a lot of men who built practices, and women seem to get to a certain level as an associate and then go off and have children. And I was like, no, I really want to practice. Like, I really want to build this. And I want to build it for women and for people like myself who are coming in and they're just looking for something different. They don't like, you know, going to the traditional medical counter and there's a window and somebody closes the window behind them. They don't like the traditional fluorescent lights. They don't like the traditional like linoleum floors. I wanted something that was aesthetically pretty so people could relax. And I feel that, you know, Cooper Orthodontics has the same philosophy. So I think that we're very like-minded that way. And I just really care for the patients. I really want them to feel better. I tell them that, you know, I may not be the world's best chiropractor. I certainly try my hardest, but I do want to try and be a great resource for them too.
Yeah, that's so important. The knowledge of what you do every day, right? That then affects you so that you need to go get chiropractically adjusted.
Right.
Yeah, big interplay there. Okay, and what? Oh yeah, this is good. So tons of people think chiropractor, oh, I have back pain, that's why I go there. What are some other reasons people go see a chiropractor?
Yeah, so that is the number one reason, right? We're thought of as back specialists, spine specialists, doctors. But a lot of people come in for headaches and neck pain too, especially during COVID. Everybody's typing at the desk, looking at their device. And so we see younger and younger children coming in for neck and shoulder issues that are causing headaches and other things. But then surprisingly, we have a lot of babies that come in and people are always like, what are the babies here for? They have latch issues and jaw issues, which is how I think we relate to the dental field and orthodontics. And so when you have a baby who can't even open their mouth wide enough for a bottle, that is not compatible with a good life. So we try and really do some musculoskeletal things and really gentle manipulation and craniosacral to work on their jaw. And then parents are like, well, they're really fussy. Well, they might be swallowing a lot of gas, a lot of air is getting in because they can't latch and seal correctly. So we work on that. And then we work on constipation if that's an issue. And sometimes they can't nurse on one breast, they can only nurse on the other, and it's because they have torticollis. And that's causing plagiocephaly, flatness of the head. So we see a lot of babies for that, which is not traditional chiropractic, but is certainly emerging as parents are wanting the best foundation for their kids.
Definitely. What have you seen anything with ear infections and chiropractic adjustment?
Yes. So we never say that chiropractic cures anything. We cannot say that. But we definitely are trying to remove any interference in the body. So if the jaw is mispositioned, the brain, not the brain, but the skull comes in 44 pieces in a baby's third trimester. I mean, it's insane. And then all of those have to fuse and they have to smush through to get through the birth canal and then expand open, and it doesn't always expand. And I'm sure that you guys have seen friends and adults who maybe their eyes a little off or their chins off, and not realizing that when they were babies they could get very gentle adjustments to help reposition that so it doesn't put pressure on their TMJ, so it doesn't put pressure on their ear canal, and then things can drain properly and they hopefully won't get those ear infections. So for babies who, or young children especially, who get ear infections a lot, we try and do some chiropractic adjustments for their neck, for their ears, for their cranium, to get the flow going.
Definitely. Even more gentle than orthodontics when they're 6 or 7. So
yes.
That's the type of adjustments. And it's really cool. My child had ear infections and we ended up going to a chiropractor and she got adjusted, and you know, I mean, she hasn't had one again.
Yeah.
Like you can't say, like you said, you can't say that for sure was the thing that cured it, because we definitely used antibiotics as well. Not trying to make any sort of statement on anything, so that's just what we did. But yeah, so I think that's a really cool. Oh, what about the palatal suture? So a lot of people hear about orthodontic palatal expansion, and I'm always explaining there's this suture in the middle of the roof of your mouth, and when we expand orthodontically, we're trying to move that apart and have new bone grow.
Right.
And I've also seen kind of an increasing number of, as the computer thing happens and we have increasing allergies, it's affecting people's teeth.
Mm-hmm.
And so what have you seen kind of used in conjunction with different things that have helped people breathe better, have better tooth position, those types of things?
For sure. So that's how I got into orthodontics and chiropractic. I had TMJ when I was a teenager, and my orthodontist was like, wait, we can't put braces on you until we fix this TMJ issue.
That's
so
good.
I know, it was great. I had never heard of it before. But I'm so grateful because then in high school and college, I didn't grind, it didn't cause me to have headaches, I had a splint, and then I still have my night guard and sleep with that every night, try and help prevent headaches. But I do think that for kids who are mouth breathers, who are snoring, you know, or they're just like, that's not healthy, and parents don't know that. If they are breathing through their mouth, their nose isn't filtering all of the bacteria, the dust, the viruses, the pollutants that are in the air, and so then that goes just straight into their lungs, like you said, causing more allergy issues. They can't get as much oxygen to their brain, so then they feel sleepy, they have the bags under their eyes, and their parents are like, oh, it's because of allergies, but it could be because they're a mouth breather and they're not breathing through their nose. So we try and help the orthodontist and help the dentist, help the lactation consultants to get that palate where it's supposed to, help engage the tongue so the tongue can help close the mouth, help, especially for young babies, if we can do some palate exercises, some desensitization of the palate so that the tongue can shape the palate like it's supposed to, that long term makes a huge difference.
Yeah.
I have a torus here in my palate, so there's this like bony little donut protrusion, and I thought everybody has that, because who like sucks on your thumb or somebody else's thumb?
Yeah.
You know, yeah. But I was told in grad school, no, that's a sign that all those sutures just jammed together and laid down bone because it was just too tight, and that's probably why I had to have some teeth removed and have braces. And it's like, oh my gosh, this is so cool that our ancestors didn't have it, we have it now, and now we're learning what we can do about it.
Yeah, it's preventative, right? And I love this whole trend that's kind of been happening. I definitely feel it in the medical community, where we're trying to do things proactively. We're trying to ask the right questions and get that proactive stuff started for children and young adults. And even if you're older, you know, go back and be like, okay, what's the cause? How do we help that cause?
Right.
And chiropractors have been on the forefront of that, I feel like, a little longer than some of us dentists, but you know, we live and we learn.
We've certainly tried to get the word out there. It's sometimes swimming upstream, an uphill battle, but we try.
It's hard, yeah. I mean, and definitely, I think we all feel that when we're trying to go the proactive route, because a lot of people, you know, you have the people who repair their car when there's something wrong, and you have the people who take their car in like clockwork, and if there's something minutely wrong, they fix it ahead of time, right?
Yes.
And so you have to figure out which belief system your patient, that one particular patient is falling into, and help guide that.
Well, and a lot of people ask me, so if I go to the chiropractor, can you fix it in one visit? Or how many visits is it going to take? And then do I have to come for the rest of my life? And I tell them, we have lots of options. Certainly, if you want to go to the gym and have a six-pack, you're not going to go one time and do abs and be like, oh, I have a six. I mean, that would be amazing. Right. But it does take consistency. It does take repetition for your muscles to develop that strength. And so same thing with chiropractic. If you are really out of alignment and your sciatic nerve has been killing you for 4 years, it's not going to get better with one adjustment. It may take several times. And so we try and put a reasonable treatment plan for our patients, and then say, okay, now you know how great it feels. It would be best to come back on a wellness basis. But if they're like, no, I'm good, then we say, great, we are here for you whenever you need us. But a lot of people aren't addicted to chiropractic. They just know, oh, I feel so much better. I sleep so much better when my body's in alignment. So I want to maintain that feeling. And I feel, again, in that way, we're very much like dentistry. It's better to maintain, if you can, than just fix problems that have been building up for years.
Yeah. Do you find that there's kind of a cumulative effort on people's bodies, like someone who's been going to chiropractic for years and been doing exercises versus someone who works at the computer for years? Do you feel like, how else do I say it, that it's additive in their life?
For sure. So to the first part of your question, when I have a patient who's been to a chiropractor, not me, but been treated and they're transferring care to me, they get better so much faster than someone who's never had that kind of body work. Also, people who are sitting at the computer all day, who may be the couch potatoes, and not getting up, not exercising, they're gonna have a much tougher time getting better than somebody who has been active, who has been eating well, who has been taking their vitamins. So yeah, it's definitely cumulative depending upon what you do.
Yeah. So what are some words of encouragement? Say we're talking to somebody who has never been to a chiropractor, right? And they're like, what are those first baby steps that I can take that are better than the nothing I'm doing right now?
So we always say, especially if it's something acute, make sure that something's not broken, it's not serious. But if you are going through traditional treatment and it's not getting any better, give chiropractic a try. And certainly you need to find somebody who's qualified. You can't expect, like you said, one visit, but somebody who has the training, who has a lot of experience with the condition you have, is going to give you a better outcome. Look at their credentials, look at their website, and see if what they're saying is reasonable with your lifestyle. But realize that some movement is always going to be involved. You will need to do your part. It's not just the chiropractor does something to you. And I think a lot of Americans are used to just, oh, I take a pill and then I'll be fine. And it's like, oh, there is a little bit more that you have to do on your side.
Yeah. And I think that's becoming more and more true as we've seen some of these like pharmaceuticals go awry, that as a medical community we're seeing it's just such a cooperative effort between our patients and us, right? All the time. I know orthodontics is completely cooperative.
Yes.
Yes, for sure. So, okay, let's see. What are some telltale signs that a chiropractor could help you other than having back pain?
Okay, so we were talking earlier about the babies,
yes.
Right? And so if you have a baby who has ear infections that just aren't getting better, or constipation that's not getting better, you've tried all the tried and true approaches, that's something. For older kids, I got into chiropractic because of scoliosis. I was diagnosed with scoliosis, and I went to 3 doctors. I went to my pediatrician, an orthopedist, a chiropractor, and they're like, are you in pain? No. So, okay, we'll just live with it. And I'm 5'2". I know you can't tell sitting, but I wish I was taller. And
we can swap. I'm 5'8". I want to be 5'2".
We always want what we can't have, right?
Right.
So it wasn't until I met a chiropractor when I was 21, past the age of skeletal maturity, who said, you could have been taller if somebody had taken you to the chiropractor regularly. And I thought, oh, what is this voodoo. And so I definitely wanted to work with teenagers and children who were diagnosed with scoliosis, and I didn't want them to have the kind of back pains that I was having before I got into regular chiropractic care and knew how to take care of myself. Sometimes we'll come across people who have chronic shoulder issues or hip issues or knee problems or wrist issues, and they're like, well, I didn't know chiropractic could do something about it, but I've exhausted all my options. I've been to everybody else. You're my last resort. And those are the challenging cases that I'm like, I can do it. I can try and help, or be a resource to them if I'm not able to help.
Sure. Yeah. Because there are limitations to every field.
Exactly.
Yeah. What are some things that you already did a lot of that. Okay. Oh yes, this is always a great question, because people always, in our field, a lot of people wait until all the permanent teeth are in. They're like, now it's time to see the orthodontist. And I'm like, oh my goodness, if I had seen you when you were 6 or 7, we could have done X, Y, Z, but now we're doing ABC, right? Mm-hmm. So when should you start thinking about taking your child into a chiropractor?
So I love to tell this story. My youngest patient was 17 hours old, and people would never think of taking their baby to a chiropractor that young. But what had happened is she was born at home, and she was the second baby, and so her mother knew immediately something was off because she couldn't open her mouth to latch. The example I was giving earlier was her, and her midwife, who had delivered the baby at home, said, you might want to call Dr. Long and see if she's open on a Friday night. And fortunately, they called at 5:30, and I stayed open and was able to get her to latch. And the stuff we do is so subtle, so gentle, that I was like, I hope this works. And I watched her open her mouth and latch. It was amazing. That is certainly the exception more than the rule, but we do have a lot of babies for that reason. I think anytime a parent is looking for more natural health care and getting their child started on a good foundation is a good time to come to the chiropractor.
Yeah, just kind of like seeing your pediatrician, right?
Exactly.
So.
We try and do well visits too. It's always better to come in when the child is well, rather than they're like, oh, someone's going to touch me and poke on me and I'm not feeling good. And then of course it's going to start out as a bad experience.
Yeah, and it's so important if you want your child not to have those kind of, and you have a little bit of a background in psychology, so you want your child to associate the doctors with, yay, I'm going to the doctor, I get a toy. It's so important to do those well visits with multiple different types of providers, I think. So.
I agree.
Yeah. All right, so what is something, so there are people that have some sort of habituation where they really do need to see you, like kind of the rest of their life, to kind of counterbalance what they're doing. What are some of those more serious situations where, it's a condition that maybe they can't get rid of, and it is something that they do need to have that ongoing care?
Mm-hmm. So sciatica is the big one that we hear about.
Okay.
And people think, oh, anytime my back hurts, it's sciatica. And I don't love that diagnosis, because the sciatic nerve is one of the largest nerves in our body, and it can get pinched in the lower back, it can get pinched in the SI joint, the piriformis muscle, the hip, the hamstring. And when I tell that to people, their eyes glaze over, because they're like, I don't know what that means. I just looked it up on WebMD. And so we try and really identify the cause. Why did you get here? What is the true diagnosis of your sciatic nerve being pinched, and how can we help that? And then teach you things to keep it healthy, to keep that circulation going. We see a lot of people for lumbar disc issues. They wake up and they're like, oh, I can't move, oh, I can't bend over, oh, every time I bend or pick up something it hurts. And I'm like, that could be a sign that there's pressure on your disc that's building up, and it could have been from being a cheerleader or a football player or a golfer when you were younger. And let's take care of it now so that it doesn't become a surgical issue later on down the road. So those are things I think that people often put aside and then maybe just take an NSAID for, where I'm like, no, we should really work on it. And of course, like we all are focused on our computers and COVID and being at the desk and stuff, posture is so important across all ages.
Yeah, it really is. So what is like the number one thing you can think that will help you avoid having some of these habituation issues and needing to seek care?
Excellent question. I think the number one thing is move. Move, people, move! Go exercise, get off the couch. Set your Outlook or your iPhone or your watch to ring every hour and be like, oh, I need to go get a glass of water. Oh, I need to do some back stretches. We are so flexed like this. Looking down, sitting down, stand up, extend, open up, stretch, and then get out and walk. I am sad in Houston that we don't get out and do that, but we're getting into the season where the weather's great, there's low humidity, so there's no excuse to get out there and just move, be active. I had a patient yesterday and she's like, well, my mother-in-law, it just wants to take a pill for her back pain, but she can barely walk and she doesn't want to move. She doesn't want to do any kind of exercise. I'm like, well, if she hasn't done anything for so many years, it's gonna hurt that much more. It's gonna take that much more to get her feeling better. But it turns out all of her doctors have been telling her, move, get up, do physical therapy. I think that's the best thing that I can tell people, to stay healthy and keep their spines as young as possible.
Yeah. Well, and people don't realize with NSAIDs, you actually can have some detrimental side effects. They're not just a completely benign thing. You, like, if they're prescribed or you need them, like, I'm not saying don't use them ever, but, have you had some patients where they're coming in and you're seeing these side effects because they've used so much?
Oh yeah, their kidney start having problems, liver, those enzymes don't look so good on blood reports, and then of course they may have ulcers in their stomach because they've taken so much Tylenol or Advil, ibuprofen, etc. And that's not great.
Yeah, no, I definitely think that we see that in our society, and we don't even realize what it's from, I think. A lot of times, just as humans,
Well, I used to pop Advil all the time in college, the slightest headache, and it wasn't until my roommate said, you might be eating too much of that I thought, oh, can it be dangerous? I mean, it tastes like sugar. It's sugar. So yeah, I think just making ourselves more aware of the things that we're putting in our body and the health benefits versus the health risks.
Yeah, definitely. Do we have some questions, Tanika, coming in?
We do not have any questions. We did have a question, but you answered it. So yeah, so that was great. But at this point, we do not have any questions.
Okay. Well, is there anything else you want to cover, Caroline?
I love orthodontics. Like I said, I got braces. My neighbor was my orthodontist. Still keep in touch with him. I still use my night guard. And when people don't understand chiropractic, I tell them it really is like braces for your teeth. We're trying to keep things in alignment. And why? Is it just purely cosmetic? No, it's because long term you want to preserve your teeth. You don't want to have a complete dental replacement. Oh my gosh, that's a lot of work, but just to think of the cost alone too. And you can't replace your spine. I mean, you can try and do surgery to fix it and have laminectomies and put rods in it, but it's just not the healthiest way to go. So when we can do chiropractic adjustments to keep things as aligned, as balanced as possible, then it just helps keep the health of the individual, just like orthodontics. And then you have to maintain it, right? Again, I'm wearing my night guard. You probably tell your patients, please go see your dentist, brush and floss, it's very important. Yeah. And so we say, do your exercises, make sure you're taking your vitamins, make sure that you're eating well, stay away from those those inflammatory foods that might, be bad for you. So I think our fields are very aligned that way.
Yeah, no, I definitely feel that way. So I think some people maybe don't realize how preventative both of our fields really gear towards.
Right.
And I think that that's really cool. And that's something that I don't know if I fully realized that until after I got into residency. How much, having aligned teeth, functional teeth, not only helps your jaw, which then can help your spine. I've seen it help upper spines at least. And so that then can help your posture and work its way down the chain. But it also does help kind of preserve your teeth, and then chiropractic helps keep your spine aligned, so then that stems out into everything else, because everything kind of stems out of your spine, right?
Correct.
So there you go. All right, Tanika, are you seeing something come through?
Mm-mm.
Okay. Now, Caroline, will you tell everyone what your social media handles are?
Yes.
Where you are, how they can find you if they have chiropractic questions?
Oh, you're so sweet. So we are on Facebook and Instagram at Westview Wellness, and that's WEST, the letter U, Wellness. Our clinic, Westview Wellness, is at 5180 Buffalo Speedway. It's at 59 and Buffalo, just right between the Galleria and downtown in Greenway Plaza area. And if you have questions, send emails to info@westviewwellness.com, and our team is happy to answer them. Or you can ask questions via our social media, and we check that often and are happy to answer it that way too.
That's awesome. All right. Well, as always, if you have further questions, put them up on the social media post. We'll do our best to answer them. I'll get in touch with Dr. Long if that's what needs to happen. And we'll see y'all next time.
Thank you.
Thank you, guys.
Thanks for tuning into this show. We want to know what questions you have, or even if there's a specific situation you want me to take a look at and share with the audience. That could be fun. Direct message us on any social media platform or email us at contact@cooperorthodontics.com. Ready for next time?